Time is running out, and so is the money. Can Medicare be saved? If you or your parents rely on Medicare, you need to pay attention because this is a big problem. But Senators Tom Coburn and Richard Burr say they do have a solution. Now, we spoke with the senators earlier tonight. Senators, nice to see you both.
Good to see you.
With you.
All right, Medicare, and let me start first with you, Senator Coburn, just so that we understand it. When, under the existing system, can we expect that it will be insolvent, that will essentially run out of money on Medicare?
Well, if you take the worst case scenario, the hospital trust fund, the fund that pays the hospital bills, will be out of money in 2016. Each year that gets worse when the trustees look at it and say, where are we? So each year it's gotten closer. The year before last it was 2017, the year before that 2018. So sometime around 2016, 17, we know, we can say pretty specifically, the hospital trust fund will have no money to pay hospital bills for Medicare.
So Senator Burr, you and Senator Coburn have come up with a new idea. Tell me how it's different from what we already have.
Well, Greta, let me say it's not new because we've incorporated a lot of ideas from a lot of people in Congress and around the country. And we've tried to put it into a bill that assures our parents and our children that Medicare is going to be saved, that brings transparency and for the first time choice to seniors so that they can actually choose a health care plan that best fits their age, their income, and their health needs. We believe that it's absolutely essential that we get seniors that are involved in the decision making on their health care, because utilization is going to be absolutely crucial in the future to the efficiencies that we need to get in health care.
Senator Coburn, you are a doctor, so tell me, what is it about your bill that is better for the patient?
They'll have better access to better quality doctors. One, if you think about what's happening in the distribution, the number of doctors that are dropping out of Medicare, not going to take Medicare patients anymore, which is a big problem for the 10,000 per day that are going on to Medicare right now, the baby boomers my age. So they're going to have access to better care, they're going to have better outcomes, and they're going to actually be more involved in their care. So that's the number one thing. Number two is Medicare is going to be saved. You know, remember, you have a Congress that's doing absolutely nothing now about the biggest financial problem we have, which is how do we pay for Medicare? So acting on that and creating a competitive market where you can actually go and buy what you want and you can hold them accountable. Right now you can't hold anybody accountable on Medicare. Call Medicare someday and see what kind of answers you can get. You can't get anything, but you'll be able to have accountability because you're buying a plan with the money that you're given to be able to buy what you want based on what your needs, your physical condition is, your health condition is, and also your financial situation.
All right, well, there are 10,000 more put on per day now of baby boomers that are added to the rolls. Unless you put the age eligibility farther out or come up with a new income source or get rid of a lot of waste and fraud or cut the services, I don't know how your plan will work. Or do you do those things?
Oh, we do. We do a lot of those things. We extend the age 2 months every year until we hit 67. We look at Medigap insurance and we income test from Medigap all the way up to the catastrophic limit. For the first time, Tom and I in this plan introduced to the American seniors an annual cap on what they would be responsible for out of pocket in the worst case health scenario. So we're basically assuring no senior that they'll ever lose everything that they have accumulated because of any health condition they may have now or in the future. And I think it's important to realize that with the types of changes that we've made, we get a different level of buy-in by the individuals that are beneficiaries, which helps us to understand much better what the future cost is going to be.
Every single person who's listening to this, Senator Coburn, thinks like, in about the age of 40s, 50s, or 60s, thinks, I paid a lot of money into Medicare. Are you now telling me that I can't get it until farther off in the future when I've paid this money, number one, and number two, it's more expensive for me, and that's what's going to happen to me? Well,
the big lie is that we've put in enough money to actually cover the expenses. And that's the political cheating that's gone on.
I mean, right now.
Yeah, well, the average couple puts in $130,000. They take out $340. Now, how long do you think that's going to last? And why are they taking out $340? You mentioned something a minute ago to Senator Burr. Waste, fraud, abuse. What we know is 1 out of every $3 in Medicare that's spent doesn't help anybody. Well, what happens if we could take that one out of every $3 and make sure it was helping somebody? We would extend the life of Medicare about 25 years just by doing that. And that's one of the things that this bill will do. We order tests that aren't necessary because we don't care who's paying the bill. Because no, the doctor isn't paying the bill, the patient isn't paying the bill, this Medicare fund is paying the bill. So when you don't care who's paying the bill, you don't care what things cost. And so consequently, we have this large component in the total health care in our country. It's around $800 billion a year that doesn't help anybody in health care. Now, the Medicare is probably about 350, 400 billion of that. So changing that extends the life of Medicare. That means you don't get the test done twice just simply because two doctors aren't talking to each other. You only get the test done once because you have some responsibility in terms of making decisions about your health care.
It seems universal in literature, medical literature, that exercise, even as an early age, or being, not being overweight, eating well, is that you will have better health as you get older.
Except for your knees when you've worn them out from being exercising.
Right. Okay. Except for your knees. Yet it's sort of interesting that the First Lady, Michelle Obama, is getting criticized by some, saying it's the nanny state because she's encouraging that people get exercise. A lot of people, a lot of conservatives are criticizing her. Fair criticism, or
No, look, it's great that what she said. She's absolutely right. We need to change our diet. We need to be more active. We need to be more physically active. And if we will do that, it will pay big dividends. We also know physical activity markedly stimulates the brain. It increases the neurotransmitters, makes you brighter for longer and smarter longer. Gives you better judgment, gives you better stability. I mean, there's nothing wrong with her promoting that. I'll give her kudos for doing it. And it's the right thing to do.
And we've tried to put together a health care plan for seniors that encourages people to stay healthy when they get sick, to get them well faster, to keep them out of the hospital, to get them to live longer. We can't end the cost of end of life, but we can drastically change that period in between.
Straight ahead, it's happened again. Another politician grabs a microphone and starts singing. Who is the latest?